The reason I started looking at ConforMIS was, why are we having so many people with knee pain after joint replacement, which is meant to relieve pain? And it became evident that it doesn't seem to be related to any particular prosthesis or a particular surgeon. It seemed to be that it is there. And as I started looking, it became evident that having a prosthesis that would actually fit the knee would be the answer. I spent a day in the operating room with the surgeon, convincing myself that this is the right way to go. And then I started using it after going through the training for it. What was so surprising and very rewarding was the fact that everything fit in perfectly. If you look at a conventional knee, what you're really doing is taking an off-the-shelf prosthesis and cutting the bone to match the prosthesis. This was the first time when actually you had the satisfaction of really having the prosthesis match the bone. From the very first prosthesis till now, you get an excellent fit because it's specifically made for the patient. I think that was the first attempt to try and get prosthesis to match the bone. The problem was it never accomplished what it was meant to do. I think that was an initial attempt. We now have a better way of doing it. We actually make it fit exactly to the size of the knee, whether it's man or woman. One thing which is pretty unique about this knee system, it gives you the ability to set the spacers of different levels on each side. So you could have a 6 millimeter on one side and 8 on the other, or you could have 6 and 10, which allows you to get the tension balanced. One other advantage of the ConforMIS system is that if you look at the lower bone called the tibia, the shape of it is not exactly the same in everyone, and one side is a little bigger than the other. Other companies have tried to address it by making what is called an asymmetric tibia, one size bigger than the other. But even then, that doesn't really solve the problem of setting it in the right place in the right rotation. What the ConforMIS system does, because it's made specifically for the patient, it covers the whole area beautifully, so you don't have any open areas. And it prevents any malrotation, because to cover the whole area completely, you cannot malrotate it, it fits in.